Hello, Integrative Health family. Thank you again for joining us from Beach No Name for another health tip coming to you. Thanks for visiting integrativehealthinc.com. Remember, even if you haven't been into our office or you got scheduled and unfortunately we had to cancel you, please pass this link on to other friends and family members, anybody else who could benefit from these, which is everybody. So the great thing is we have such a great community of people coming out with amazing stuff, but please share. Okay, so today we are doing what's called 7 series joint release. So a lot of us have been sitting around now for a week, 2 week, 3 week, whatever the heck time it is anymore. I'm starting to lose track already. And we're sitting on the computers. We don't have our ergonomic desks with us, so we're starting to get a lot of postural strain in different places. We're sitting on the couch with our laptops. We're cooking all the time. And so lots of chopping muscles and things going. So our joints and stuff are working in a different way. Our muscles are working in a different way. So this is a great exercise to help balance everything. So it helps balance all the joints, gets microcirculation and fluid moving in the joint spaces. It's going to really help with lymphatic fluid, which is great for your immune system. So get that lymphatic fluid, move it up and down so it's like a pump, okay? So we're going to start down at the bottom. My daughter Lola's camera crew here, and she's rocking it out. So we're working from the foundation up. God, I wish I could flip my head and look at you right there. Foundation up. And so you're going to put your hands on your knees, feet together, okay? Now you're going to do a nice circle one way. And you're going to do this for as long as you want. There's no time restriction. You have all the time in the world to do this. All right? Now, if you have arthritic knees, you got some junk in there, some old surgery, scar tissue, you might not be able to go as deep in range of motion. But if you have pretty healthy knees and ankles, then get down. All right? Get down with that range of motion. That'll really get a lot of dorsal flexion going in the ankle. Really good for the Achilles, plantar fascia. Okay, so you can do that as long as you want. Again, you can go a little faster if you want. You can slow it down, real slow, and then reverse it. So we're going to always reverse everything. All right, so until you stop hearing some popping, it feels nice and smooth, you're good to go. So now we're moving up to number 2. Feet are going to go shoulder width apart. Hands are going to go on your hips, okay? So I'm just going to show this to you from behind. I want your thumbs right at the top of this SI joint. When you're moving, your hand should be on this iliac crest. So you should feel your hips doing this, okay? So you should feel this space opening up and moving underneath your fingers. And this is really getting a lot of movement in these lower vertebrae. So if you have L4, L5, S1, any bulging discs or stenosis, little arthritis, this is for you. Especially if you can't come in to see us at the office, so do this a lot, okay? Hands on hips, okay? Alternating, so this knee is going to go into flexion, this is into extension, and that's all you're going to do is reverse it. So flexion, extension, reverse. Okay, play some good music with it. Again, do this as long as you want, but make sure you're feeling that movement. If you're not feeling movement underneath those thumbs, if you're not feeling this little thumb move, then keep doing it until you do, okay? So that is number 2. Number 3, here we go. Number 3 is the hula. So we're going to be focusing, so we were in ankles and knees mainly, then number 2, we went from ankles, knees, got some hip, low back involvement. Now we're going to get hips and we're going to start moving up into thoracic spine. All right, so nobody's watching you do this, or if they are, they're having a good time watching you, but you're not at the office, so you have no excuse to not do this. A lot of people have a little problem doing this one, okay? So hands on hips, okay? And you're gonna go, woo! So pretend you're in a bowl and you're trying to wipe chocolate off with your hips, okay? my daughter Lola likes that. You just think it's funny? All right, but get movement, so you really wanna feel pretty fluid here, okay? And so again, push that hip out, stretch that hip, right? You should feel a little stretch in that hip, so push it out as far as you can. Have a good time with it, okay? Then, guess what? Reverse it. Now, you might notice it's harder to go one way than another, so that tells you something about that hip, okay? So I'm getting a little movement in my knees, a little movement in my hips, really feeling that low back. You should feel these vertebrae. If you put your finger on them, you'll feel all these little babies moving. All right, we've had enough of number 3. Number 4. All right, feet go a little wider. Number 4 is up here, and we're going to go side bend, around, up and over, okay? It's okay to get a little extension. Your back is supposed to extend, but don't go too far, especially if you have any back issues. So up and over, let gravity take over on your forward motion. So here to here, lateral stretch, getting up into this lateral line, drop over, up and over. Okay, so nice and smooth. Reverse that when you're ready. You know, this is like our 20th take, so I've done this 20 times so far, and I still like it every time. No, I'm just kidding. It's only take number 3. 4. All right, so anyway, there we go. So that was number 4. Number 5, this is based off of a Tai Chi Qigong move. So the movement is initiated with your hips, so it's a hip whip, and then you let your arms are naturally going to want to swing, okay? So you're just building on that momentum. And I really want to hear your hands slap your body. So this hand's slapping my shoulder. This now, when it comes around the back, it slaps my kidneys. So in Chinese medicine, this is what it looks like hitting your kidneys. Okay? So the kidneys are the foundation of everything in Chinese medicine. So it helps to stimulate them, which is going to in turn, it's all about the immune system now. It's going to help in turn stimulate your immune system. And again, we're getting that lymphatic fluid moving. So just keep hitting it. If you're not hearing that noise, then you're not doing it hard enough. Okay? Get the blood moving. So that is number 5. All right, number 6, coming up into shoulders and neck. So we're going to do alternating shoulder rolls. Now this is really good to help open up the rib cage, help open up the lungs as well. Loosen the muscles from your shoulders up into your neck. So we're going to go here. And if you've had shoulder issues like my left one, I got some interesting noises coming out right now, but it actually feels good. And you also, like this area on me is where my issue happened a long time ago. So I'll actually feel like it's pushing air out of my left lung. So you can just tell there's a little more congestion on that side. So kind of check in with your body, see what you feel like you have going on, right? So each thing, notice, is it harder one way or another? Do you hear noise on one side, not the other? Then reverse it. I don't know if you can hear that or not. Can you hear my lungs? Okay, that's number 6. Number 7, last one. You're going to go ear to shoulder, let it roll forward, let gravity take over. So ear to shoulder, gravity take over, ear gets to other shoulder, up and over. So for healthy necks, you can extend a little bit. Just don't stay really back, too far an extension. The cervical spine is supposed to extend. Now I like to do this with my eyes closed. If you're not used to it, do it with your eyes open for balance. Okay. And this is the one that grosses everybody out. If you've had strain on your neck for a long period of time and you haven't been doing movements like this, you're going to hear a lot of gristly, poppity sounds. That's called decrepitus, which is a horrible sounding name. We need to come up with a more positive name. By the way, reverse it when you're ready. So decrepitus. And anytime we've had long-term postural stress and compression on our neck from poor posture or other things, we start to get a lot of stagnation, which leads to inflammation, which leads to little arthritic changes and degeneration and all that other good stuff. And so this really helps prevent the arms from going numb, helps prevent from neck pain, helps prevent from the growth of all that gross stuff in your neck. So just do it until you don't hear that noise anymore. And again, now's the time to take this one on, because you got hopefully not much longer before you can get back to it. But it feels good. So again, do that one as long as you want, especially if you have a lot of that decrepitous sound going on. All right, so 7 series joint release. I tried to make that video sweet and simple and short. I don't think I got to the short. Hopefully I got to the simple and sweet. Thank you very much. Stay tuned, integrativehealthinc.com for another health tip coming to you from Beach No Name or from somebody's living room. Thanks.